And this is the first of what we hope to be many free webinars in our series, giving back to our alumni and our students and our wider iheed network. So we just want to say thank you for being part of the iheed community. Some of you are our students and alumni, and some of you have just found out about this webinar through our social media channels. So very welcome to you that do know iheed and who don't know iheed. For those of you who don't know who we are, I'll just give you a very brief synopsis of who we are. We're an online medical education organisation, and we deliver state-of-the-art postgraduate medical education programmes, and they are accredited by world-leading universities and professional training bodies. Our goal is to help clinicians develop or deliver better patient care and enhance their global mobility. So we have one of our leading flagship programs at the moment is our MSc in diabetes, of which we have many alumni. And our latest program is another pediatrics program accredited by the Royal College of Physicians in Ireland. And we have a suite of programs coming next year. So we have students from all over the globe. And as we have expanded, we've had the privilege to interact and befriend very, very passionate people who are leaders in medical education across the globe, one of which is our friend, Dr. Munerato, Rafael, who is here with us today. So we're delighted to have him give our inaugural webinar to our alumni and our network. Just to give you an overview of Rafael, Dr. Munerato's biog, really. He's a consultant advisor for healthcare organizations providing business training for healthcare providers across the globe. He graduated in medicine and residency in clinical medicine, cardiology, and clinical arrhythmology. He has an MBA in health management from the very prestigious FGV in Brazil. He's a medical director for the Santa Paula Hospital in Sao Paulo, where he developed projects for the implementation of policies, routines, and protocols for ONA, which is a Brazilian National Accreditation Organization, Canadian and JCI accreditation programs. He's a regional medical director for Sao Paulo at the DASA laboratory, which is the largest medical diagnostics company in Latin America. He has been speaker on programs and medical congresses and conferences across the globe, and he has developed multiple healthcare management and leadership programs. So just before I hand you over to Dr. Munerato, I'm just going to do a little bit of housekeeping. As you may have tried, you cannot unmute yourself. That's because we have a large participation group here today. So just to reduce ambient noise, you cannot unmute yourself and you cannot share screen for security purposes. But we really welcome interaction and want interaction and questions at the end of this webinar. So we openly and warmly ask you to put your questions into chat. So Dr. Munerato's presentation will take around 40 minutes, and at the end of that we'll give 20 minutes for just questions and answers, which you can put into the chat, and we will read out, I will read out, and Rafael will answer. And if we don't get to some of your questions, I will answer them, and Dr. Munerato will answer them after the presentation and after the webinar. So without further ado, I will hand you over to Rafael.
Thank you very much, Rebecca. Thank you, Tom. It's a great pleasure to be here once again in a webinar with iheed. And thank you everybody for your time, for being here with us. Actually talk about healthcare business is one of my passions, because I truly believe that every healthcare professional must know better the world of business in healthcare. Actually, all of us are aware that the healthcare world is changing so fast. We deeply need more innovation initiatives, and the basis for all of this is to know a little bit more about healthcare business that we actually know as professional healthcares. So let me start to sharing my screen. And as Rebecca said, I will talk for 40 minutes. I divided my presentation in 4 different parts. And what I intended to bring here for our discussion is the main tools for us to know how to perform a business plan, how to perform a strategic analysis, and in the end, the main concepts of innovation in healthcare. So let me share my screen. And Rebecca, please, if anything happens, stop seeing my screen. Please let me know. Contact with me, okay?
Of course.
You be my safe. So, business plan in healthcare. So far, this is the only slide presentation that I have here to discuss with all of you. I used to call this slide the 2-year MBA one slide. So here is the 4 main concepts that we will deal in this 40 minutes. So let's start, okay? Everything that is in here in this slide, as I said, is the main tools for us to understand better the healthcare business. And everything starts in here. Everything starts with this first part when we should perform a business plan. So the first step in this first part, we must have a business plan. Some of us has a office, a cardiology office, pediatrician office. Some works in a hospital or an ambulatory, and we can make a business plan for example, my office or my hospital, but I also can perform a business plan within the units in the hospital. For example, the critical care unit or the emergency department, and for that matter, whatever you choose. I like a lot to use this tool. This tool is the business model canvas created by Alexander Oswalder, a Swiss entrepreneur, and is one of the 5th most used tools to perform a business plan. So this is our first step. We should know how to perform a business plan and find our company identity. The main purpose here is for us to know better, more deeply, what are the strengths of our company, of my hospital, or my clinic, and also what my weaknesses. So let's take a look in this Canvas business model. Some of you already know about this tool, some don't. So let me start to showing a little bit how it works. So here we have 9 blocks. And the wonderful thing about the canvas is that, as I said, I can perform a canvas for my hospital, or I can perform a canvas for example, the critical care unit. So it's a very flexible tool. And these 9 blocks, they are, the first one, you must know who are your customer. This seems a very simple question, but it's not. Actually, most of us, we think we know better our customer, but eventually we probably should know much deeper, especially concern what is value to our customers. So these 2 blocks usually go together, because in order for me to know who are my customer, I need to figure out what is value to my customer. The 3rd block and the 4th block that we have to draw, we have to analyze, it's the channel blocks and the relationship blocks. What that means, you have to know how to gain new clients, how to say to the clients and what are the values that you are able to provide. So here we talk about the marketing initiatives, and in this block our concern is to gain new clients, and here in the relationship it's in the to fidelize this clients. Here we usually are concerned about the cost of acquisition clients, and here the lifetime value of a client. And you know that nowadays, the investment companies, for example, they like it a lot, those two indicators, the cost of acquisition of new clients and the lifetime value of those clients. And after that, we know that those clients will bring us gains, okay? Financial gains and no financial gains. For example, my patients here in Brazil, they are insured, so this patient provide me some non-financial gains. And another client of my office, the insurance company, actually provide me the financial gains. So let's keep going. Here in the sixth block, we study about our key resources, okay? So the human resource came in here, our equipments, our inventory. Usually in healthcare sector, the most important resource is human resource, because it's so difficult for us to have a good team. So here is where we study the healthcare leadership, the difficult situations that we can deal within our team and with our patients. And of course, we don't do anything by ourselves. We count on key partners. So in this other block, we study our suppliers and which services we will outsource. So this is a very important block in here, because this is one of the strategic choice. We have to choose which resource are we gonna have by my own in my company, and which of those resources we will outsource, for example, to a partner. And with this help, we can draw our key activities, the most important activities that will create the value that we will deliver to our customers. And of course, in here we have our cost structure. Everything in here, it's giving us gains, financial and no financial, and everything in here will cost something to our company. Once again, financial costs and non-financial costs, eventually time cost and another type of costs. And this is one way for us to divide the business model canvas, okay? So all of us know that the main formula for every business is that profits is everything that we gain minus everything that costs to our company. So everything that we gain, we will see in those blocks. And eventually here, it's gonna be the most strategic choices that we can make. For example, to gain new customers or to gain new markets and another initiatives. And here we have our operational efficiency. So this is a very important concept here, the operational efficiency. And this is the very, very superficial view of the canvas, because our intention here is just to highlight the main aspects. After you perform this business plan, you were able to find your company identity. So here you should make the statement of your mission, your vision, and your values. Reminder that the most recent authors and professors, they encourage us to establish the vision of our companies regarding the social values. In this other slide, I put, just to help this concept, a very, very interesting pyramid of value, of elements value, created by Bain Company. It's a consulting company. And this pyramid helps us to understand that the values that we can create to our customers can be divided in at least these 4 perspectives, and see that the functional values that most of us are able to identify, for example, save time, reduce effort, quality, reduce risk. It's fundamental, it's very important, but they are functional values. And we must not forget that other values as reduce anxiety, okay, provide access, the value of your brand, provides hope, affiliation, and in the end, the social impact that our company can provide is the most value of all of those aspects. So after we perform this kind of analysis, the second step should be us to start to use the SWOT analysis. SWOT analysis is a very old tool, probably described in 1970 or 1980, but still a very valuable tool because the SWOT analysis stays for strength, weakness, opportunities, and threat. And after you perform your business model canvas, you are only able to fulfill your strengths and your weaknesses. And that's why it's so important to know your company and to perform a good business plan. Because in order to describe your opportunities and threats, that we will go to the next level over here, where we will apply another tools to look outside our companies. So once again, here we look within our company, we look to our capabilities and how are we able to provide the value to our companies with our resources and being financial viable. And over here, the second step, we must look at outside of our company in order to fulfill these two blocks, the opportunities and the threats. And the main tools for us to do that is use the famous 5 forces of Michael Porter. So everybody knows Michael Porter, it's a professor in Harvard Business School, and he described these 5 forces that, once again, we don't apply the 5 forces to our company. We should apply to our sector. So if I am constructing my business canvas, my business plan to my hospital, and I run a hospital or a critical care unit or a cardiology office, I must understand how is this sector in my city, in my state, in my country. And the 5 forces of Michael Porter are the competitive rivalry. What that means, how many other competitors do you have? And you should not look at those competitors as an enemy, okay? We have a very brilliant concept by the professor James Cars in New York University called the infinite game, infinite mindset, that this professor says that we should look at worthy rival. What that means, other companies that help me to get better, to improve. Nonetheless, it's very important to know the competitive rivalry in your segment. And if you are in a city or in a state that you don't have too much competitors, you should know that maybe some other companies can entry in your market. So this is the threat of new entries. And you know that the entry barrier, it's a very important concept in business. And of course, some innovations can substitute what you're doing. For example, here in Brazil, because of COVID, we recently have the approval to use telemedicine. And the telemedicine, it's a kind of a substitution for some clinicians, for some appointments in my office. And I don't know if I will be able to perform or not. So the threat of substitution usually comes with disruptive innovation, okay? The other 2 forces of Michael Porter, it's concerned about the supplier powers. Once again, here, Porter is talking about this block, okay? The importance of our partners, these partners, some outsourced companies and some suppliers, and how powerful is my supplier, for example, and of course, the buyer power of my clients, okay? So those are the 5 forces of Michael Porter. And after that, we have a next 2 that I like it a lot, called the Pestle analysis, okay? Let me write down here, is the Pestle analysis, that this is an acronym for political, economic, social, technological, legal, and environmental. What that stands for, that there are several other things that could influence our business, and usually you don't have you don't have control of those factors. So this is why it's so important to know our sector better, to know the news, what's happening in our economics, what happens in the change of the society, the new laws, or the change in our environmental, and for sure, the technological disruption. Every healthcare professional nowadays are a little bit concerned about artificial intelligence, because it's another skill that we don't have in our universities, okay? But this is a concept, actually this is a misconcept, because the artificial intelligence and other data science tools, they are coming to help us. It's not going to be the human versus the machine, but probably the human plus machine, and gonna help us to deliver better value to our patients. And after we perform the 5 forces of Michael Porter, and after to run the past analysis, we come back to SWOT, we come back to this tool that help us to compare our company, my department, with the environmental. And then I can write down my opportunities and my threats. So this is a very famous tool, second tool, and a second block. As I said, I divided here in 4 different parts in this my presentation. So here we understand better our environmental, our company. Here I look outside my company. Usually companies lack the intelligence of the sector. Actually, this is one of a new executives jobs, okay? The chief intelligence officer, because it's very important to know better what the environmental is offering to us, so we can enjoy the opportunities and the threats. Okay, the next step over here is, once we study our company and study the environment, the outside of our company, we must perform our strategic plan. And for sure, when we say strategic plan, everybody remembers the concept of Kaplan and Kaplan-Meier, another tool that was described in 1980. And those 2 professors, Kaplan and Meier, they create the balance scorecard. So what is the balance scorecard? Is a tool that don't only focus on financial performance, okay? So these 2 professors, Kaplan and Meier, they said in 1980, 1970, I think it's wrong a company only look at their financial performance, because in 1980, if you ask for somebody, so how is your company? Probably they're gonna ask, oh, it's wonderful. We have great revenue, growing revenue. We have we have a very stricted costs, directed costs, indirected costs. We achieve the break-even very soon. We have an EBITDA, very profitable, so we are fine. And those authors, they said that this is not true. We can't look only at the financial perspective. So they propose for us to look at 4 dimensions, okay? The learning and growth dimension, they look at our employees and our ability to create new capabilities, to retain our leaders, to retain our value human resource. After that, we should look at our processes. So you should look not only to financial, but to non-financial performance. So how is the KPI, the key performance indicator in your process perspectives? So in our healthcare sector, for example, here we are concerned about our quality certification programs. So as Rebecca said, the Canadian, the Joint Commission International, and other quality certification qualities in your own countries. And after that, how is your customer seeing about our company? So for example, what are my market share in here? How are my evaluation of my customers? We usually use a very important tool called NPS. I also have in here, in order to show you, because it's a very important tool, the Net Promoter Score. So this is one KPI, a very, very important KPI. Let me show you here, okay? So this is sorry, let me take it here. Okay, now gonna work. All right, so it's a very important KPI, key performance indicator, this Net Promoter Score. Actually, Net Promoter Score came by an article that the author said, this is the only thing that matters for you to know about your customers. The Net Promoter Score is not used by all sectors, but in the healthcare sector, it's very, very valuable, because in this tool, we must ask to our clients, what is the probability for you to indicate my office, my clinical office, to someone that is your family or your friend? And if my customer says it's 10 probability, he will for sure indicate my services, okay? It's a higher Net Promoter Score. If the client sets 0, he absolutely not gonna indicate my office. And how we calculate the Net Promoter Score? The clients that scores me 9 and 10 is called the promoters. So I must figure out the percent of the promoters, and promoters minus the percentage of the detractors. Every client that scores me 0 to 6 is the detractors, okay? So here in Brazil, our hospital has a meaning of the Net Promoter Score about 59, okay? And the total number of Net Promoter Score is from 100 to minus 100. So here we have a benchmarking here for Brazilian hospital. What is your Net Promoter Score? So this is another very important KPI of here, the customer perspective, and of course, the financial perspective. And Kaplan and Meyer, they said that the balance scorecard, that's why they call balance, because I must balance the financial with the non-financial KPIs. They said that it's not just a collection of KPIs, okay? Usually the companies has 25 KPIs, for example, but it shouldn't be a collection of KPIs. Better than that, those KPIs must have a relationship, okay? And so if I increase my KPIs in the learning and growth concerning about my employees. I will make my internal process better, and achieving those KPIs, I will for sure deliver more value to my customers, and for that matter, I will have better financial perspectives and growth, okay? And here I'm not gonna enter in deeply discussion about this, but the OKR, yeah, it's a very, the OKR for objectives and key results, it's a very useful tool for the IT sector, and a lot of healthcare companies starts to use this because we can link the OKRs with the balance scorecard, especially because the OKRs helps you to identify strategic goals, objectives. Okay, Kaplan Norton also told us that, but the philosophy of OKRs, they divided those objectives in the quarters of the year, and they have a very open policy in order that I can be a medical leader of the cardiology in my hospital, and I know what are the strategic objects and what are the key results, for example, of the neurology department, of even the CEO of my hospital, okay? So this is a very interesting tool for, in another opportunity, we talk a little better about it. And finally, we reach here the innovations tools, okay? So the innovation, once again, it's a very important field that mostly company thinks that they do or they perform, but not sustainable. And every company nowadays understand that innovation is the key to survival, okay? The COVID-19 is here to show us how fast everything is changing. And actually, the very crisis of COVID-19, it's because it is a very rare event that something changed a lot of aspects of this past analysis. So what are those tools of innovation? So in order for us to understand better, let's think, okay, let's think that your business, okay, here you can see a very small canvas that I draw, and I'll be here, okay, here in the bottom, because we usually can divide it, our innovation initiatives, in two squares portfolios, okay? This portfolio is called the Explore portfolios. So here we're gonna search for innovation, and here we call the Exploit portfolio innovation square. So let's start here. So let's say that I have a new idea, okay? I have a new idea that came when I observe my customer, I perform a design thinking workshop and identify some things that I could do better, okay? So what is the main aspects of this square that we call the Explore journey? Is that my idea in early the beginning has a very high risk of doesn't work, and I don't know how is the expected return. So in order for me to pursue this path, okay, this is the ideal path here, where I reduce my risk and I have more guarantee of my expected returns. How can I do this? How can I do this path? Through experimentations, okay? So this is a very important concept here. The uncertainty is something like that, as described as the authors, and then this uncertainty, they will going to diminish with time. Let's just, okay. So once again, sorry, let me draw another canvas in here, okay. So once again, my canvas in here have to pass through experimentation to reduce uncertainty and pursue this path, okay? And those experimentation cost money. So this is one of the first important concept here in this explore journey square, okay? We must choose 10, 100 ideas for one idea after testing proves expected return and a diminution of the innovation risk. And once I can do that, I can prove that that idea is worth, I can cross through the explore journey to exploit journey in this square. So here is where my business is more mature, okay? I am not longer in this explore square. I am here, and here I will apply everything that we talk. I will enhance my business model. I will look even better to my environment. I will follow my strategic plans and KPIs so I can grow. Now I have a business, okay? Now I have a business that I will use other tools. For example, the quality tool of continuous improvement, plan, do, check, act. And once again, I should not forget that even when I have a mature business, I will suffer the influence of my external environment. And here is one very key takeaway. Even when we have a very established hospital, a very established office, never forget that the 5 forces of Michael Porter, the pest analysis, will put you in some threats, okay? And if some of those threats increase your risk, the risk of death of your business, probably once the business is in here, the business can do that. What that's supposed to mean? In here, I have low risk because I know my environment, I strengthen my company, and I have a great return, okay, a financial return, but with a change in my environmental, I can do that. And if I do that, means that I'm losing my revenues, I lose my margin, and I am closer to the valley of death, okay? The risk of death, because something changed. And if that happens, once again, I have to look at this framework and take my business, if necessary, back to here and start to testing again and to do the change that I must do to continuing to exist. Another important question, just to finish my explanation, here, usually when you have a mature business, you have the incremental innovation, okay? So, for example, I already have a great emergency department, but I do some changes that the patients wait not that much. In my average of waiting time is, for example, 1 hour, and I can reduce to 40 minutes. So I am saying about the incremental innovation in here. And in this square, we talk about the disruptive innovation. Another important question here, we need good managers, okay? Very good managers to increase our business. Here, we need innovators, disruptors, okay? They not necessarily are the same persons, okay? So it's some authors says that we shouldn't say in our company that innovation is something that everybody must pursue. It's not necessarily true, because you need the two kind of expertise. We need excellent managers, and we need excellent personnel that are open to pursue new ideas, to pursue design thinking, analysis, and bring innovation, okay? So this is it, my 2 years MBA in one slide. Of course, our intent here is just to present you and all of those tools they took time, they took great effort, they demand a large discussion with our team, with our personnel, but those are the main tools that we have in healthcare sectors. So I will stop to share my screen. Let's come back here to Zoom in order to see you. And exactly 7:40, okay, 41, we can open to discuss if you send us some questions, please. All right.
So much, Rafael. I know that some ISM, he was experiencing some volume issues. He couldn't actually hear us, but I think he's the only one that had a technical issue out of the whole group, which is over 100 participants, I think around 110. So just to let you know, everyone, we will be sending the recording of this webinar today to you afterwards with a little bit more information about Rafael and about iheed and the recording, so you can review it yourself. But I can see a chat. Can I get the recording? Yes, you can. You will get it. Takes a while to stream it and put it up on YouTube, so it will be most likely Monday when you receive it, if that's okay. But you will receive it on Monday, Fibin. No problem. Any more questions?
Yes, Rebecca, I think it's important to tell that we intend to program a workshop in iheed where we can deeply see and perform some practical lectures in order to better understand all of those tools and apply in our business. If you could please say a little bit about it.
Of course. So there will be, and you're very welcome to join us, a follow-on extended workshop that goes into a little bit more granular detail with Rafael on some of the aspects that he covered today. Obviously, healthcare management in a healthcare setting is a very intensive program of study. So today is just really a teaser, a sample, a taste of what you really need to know as a healthcare professional running your own business or working at a senior level in a clinical setting. So Rafael does have a follow-on workshop. There is a small cost for that. You're under no duress to do that whatsoever. This is a thank you to all our iheed community for participating and being part of the iheed network. But we would strongly advise that you do it, because Rafael goes into a lot more detail around innovation, around just very important aspects of healthcare management that you need to know for day-to-day management of a clinic and a healthcare setting. So we would strongly advise it, and we will send you some information about that.
Fantastic. And Rebecca, I was able to see the chat, and we've been asked to share some practical real-life examples about the using of this tool, okay? So I will come back to my slides presentation, okay? Share my screen, and I can perform some some real-life examples in using those tools. So let me share once again. I will come back at that slides in order for us to discuss a real-life example. So let's see. One real-life example that I like a lot to demonstrate is from a hospital here in Brazil, okay? That is a huge hospital, okay? A huge hospital, but that hospital were prepared to very, very difficult surgeries and very complex patients. And this hospital starts to lose profit, okay? So let's start with this formula. Profit, it's what this hospital gain minus the cost, okay? So probably this is the most simple as most important formula in business sector. So every business would like to enhance the gains, okay, the revenue, and try to reduce the cost. Of course, concerning about the quality issues in here, but mainly this is what every company do. What can I do to enhance my revenue, my margin, my EBITDA, and reduce my costs. So let's say in this real life example, this hospital, they are facing practically zero profits, okay? They are nearly break even. And so if this is happening in your office or in your hospital, and seeing here in our first two, the business model canvas, what is the most easily thing to do, and eventually is the first thing that every company does. If you are losing profit, okay, it's much more difficult to enhance your gain in a short period. So everybody look at here to reduce costs. That's what we call operational efficiency. And in order to reduce cost, we have to look in here, in those blocks of our business model canvas. So this hospital starts to look, first of all, in their partners. So they review the contracts with the suppliers. Is there a room to reduce the price of some pharmaceutical medicines, for example, or even change my supplier in order to reduce this cost? And the hospital did that, but wasn't enough. The second block that every company looks at is the key resource. And eventually, those companies look at cost to reduce the human resource back office, for example. And here we have in the financial document income statement, okay? So we have a document called the income statement. And in the income statement that starts with the revenue, and then we have the direct cost and the indirect cost, so-called SG&A, okay, or OPEX here. The directed cost are the costs that are dealing with our practice. We say that they are touching the patient here. So in this cost, we have the nurses, the physician, the physiotherapist, okay? So in the first time, we usually don't try not to cut any cost direct. We look at here at the administration costs. So for example, you reduce your marketing budget, you reduce some event that you're gonna perform, for example, to enhance your customer relationship. And once again, that hospital in our example did that, okay? But wasn't sufficient, okay? They tried to reduce the maximum cost they could, but wasn't sufficient. So they start to look how to enhance, how to raise their revenue. Okay, here we call operational efficiency. Here we call strategic choice. So what this hospital did, the hospital realized that they have a very robust structure to deal with complex patients, but they have a lot of patients that they receive that are not complex. For example, the pregnancy, the deliveries, and the pediatrician sectors. And then this hospital made a strategic choice. They finish the pediatrician department, okay, and receive the oncology and neurologic patients, okay? So those clients, oncologic patients, neurosurgery patients, of course, they have a higher revenue means. So they increase their gains and raise their profits. And that could raise a question. So pediatricians in hospitals, they are not profitable. In the future, we will no longer have those pediatrician patients in our hospital. And this is the wrong way to frame it. okay? It's not true that pediatrician can't provide profits. The truth is, if you have a higher cost structure, you can't have low revenue activities, okay? So in that particular hospital, the pediatrician sector wouldn't be able to generate profits. But if you see another hospital with another business model canvas where your structure, your cost structure, it's more fit, okay? It's more directly related to non-complexion patients, the pediatrician can be a very high profitable activity. So this is one thing that we can bring to our real life. And once again, this is a strategic choice that will drive your company identity. And you must know what is the environmental of the pediatrician sector, how many hospitals they are directly seeing pediatrician patients, or how many hospitals they choose to serve that segment of customers. And as I said, see what are your strengths, weakness, what are the opportunities, threats. For sure, design some KPIs. And as I said, if you have process direct to those clients, you will be able to be financial sustainable, okay? So this is one example. And nowadays here in Brazil, as I said, we recently have the telemedicine authorized by our governments. So this is another great example. For example, I am a cardiologist and I did not perform telemedicine, but now I can do. What we usually say to our students here in Brazil, our medical students, is to enter in the telemedicine market cannot be like you download an app, you know? It's not plug and play. In order for you to enter in the telemedicine market, you should perform a business plan. I must return to my clients and see the profile. Who among my clients would like to receive the telemedicine? Can I perform telemedicine? I know how to be digital empathy to my patients, okay? I have the capability, I have the resource, I have the software, okay? My patient also, they have this capability, okay? For example, the majority of my patient, they don't have Wi-Fi. Probably I can't go through this path, okay? And I'm not gonna be success in this path. So once again, everything is resumed in you, knew better your customer, knew better your capabilities, and design the experimental. I say that a lot also, okay? In telemedicine here in Brazil, as we just started, it's not about how much money are you gonna make with telemedicine, but in these early beginnings, how much I will learn with the new activities in order for me to get better and better, and if necessary, change my system, and if necessary, I can reach my patients and see that none are able to perform telemedicine, and I can reach a different market. I can open my activity to a new market. So those are some real life examples.
Super. Just a few more questions there, Rafael. There was one from, or it's actually two from Shema. One was thanking you for the presentation, and she said she's one comment in the business plan. She doesn't think it's as straightforward or black and white, and sometimes your gainers may cost you and your cost items may make you gains, is her comment there. So
for sure, I totally agree, okay? I totally agree. And once again, you must draw some financial and non-financial gains and financial and non-financial costs, okay? So we should look at a broader perspective, but I totally agree with your comment.
Brilliant. And Rana has a question here Thanks a lot for the interesting presentation. We'll be interested in knowing a little more depth in regards to the SWOT and PESTLE, etc., and correlation it again to real examples in the industry. So
Sure.
yeah, that would take a while to go through, but yes, of course. Go on ahead, Rafael. So it
Sure,
would take a while.
Actually, you know that the PESTLE analysis, when we go to the books, okay, the business books, we can find this PESTLE analysis regarding our sector, our city, our state, our country, and even the globe, okay? We have this already described. We can perform the PESTLE analysis concerning the whole globe, but it's very rarely done. The real example regarding PESTLE analysis comes with the COVID crisis, okay? As I said, in this year, when the COVID appears, the COVID changed everything. And if we perform the PESTLE analysis, COVID-19 is a very good example, because in several countries and all over the world, the COVID changed the policy, changed the social behavior, changed the technology disruptors, changed the economics because of the economic crisis that we are dealing with, changes the legal segments. Here in Brazil, we have new laws each month, okay? So it's very difficult to stay up to date with all these changes. Once again, what happens in COVID is very rare. Usually, we perform the PESTLE analysis when we read newspaper, when we have a professional network and we talk each other, when we study what happened in the past history. Okay, so this is a field we call scenario analysis, and it's a very huge field, a very difficult one. Okay, the capability, the ability of someone to perform a scenario analysis, and those who can perform a scenario analysis are those who can enter with some innovation that provide them the competitive advantage. Okay, so it's a very important tool. I like it a lot, PESTLE analysis, but once again, it's a difficult tool that it's important for you to, for example, perform a workshop with everybody that works with you, and even bring some experts for these other fields, economical, legal, political fields, in order for you to understand better, to get the information. As I said, some companies nowadays, they have the executive responsible for the information. They call chief information officers. It's like the CEO of the companies, you know, because it's so important to know what it's happened. But once again, it's very difficult to have the key informations.
Brilliant. Rafael, I'll ask one more question, and this is from Avasak Vasatarji, and it actually relates to COVID. He said in the COVID situation, the hospital has a lot of expense for PPE, you know, the protective equipment, and extra expenses for the healthcare professionals. But in the private sector, the patients are not prepared for the additional expense for money for this purpose, I presume for PPE expenditure. In this regard, many newspaper reports have been done in different media, and how are healthcare managers expected to manage this situation?
So it's a fantastic question, and this is true, I think, in all healthcare sector, okay? Hospitals, offices, not only the physicians, but all the healthcare professionals. And one thing that could help this situation is for us to look to new models of payment, because when we concern about this increase in costs caused by the COVID-19, and this personal equipments, we are thinking about the fee-for-service type of revenue. So, for example, I charge for my cardiology visit, okay, and I start to take more costs in my offices. I'm thinking in fee-for-services revenue. But if you think about the new models of revenue, for example, bundle or global budget fix or capitation, you will start to be to receive for the line of care of this patient. And in this line, you must already introduce this new kind of costs, okay? And you can adjust. For example, if you receive to take care of, let us say, 2,000 patients for an insurance company or for an HMO, healthcare maintain organization, or even for a company, okay? Let's say a company in your country directs to you 2,000 patients and you receive monthly to take care of those patients. Maybe some patients in the early few months, you will spend more time. You must perform more visits. But after you take care of those patients and you enhance the patient empowerment, it's probable, it's very feasible that you will recover those initial high costs, you know? So this is a very important, because it's not only in Brazil. When you study books about the healthcare sector all over the world, and we have books of that, the main mechanism of the healthcare professionals to receive is still fee-for-services, okay? Is still fee-for-services, except in the public sector. But if we change the way that we can receive to take care of those patients, we will be able to adjust our higher costs with personal equipments and begin once again to rise our profits.
Super, Rafael. I think that's all we have time for. But I think it's been absolutely wonderful webinar. And just to let you know, thank you so much to everybody for joining today. We had over 100 clinicians, around 110 clinicians, and it was wonderful. So we will be sending you the recording of today's webinar and some additional information about the ancillary workshop that Dr. Rafael has, if you'd like to partake in that, and just some information about iheed as well. So thank you so much to everyone for joining us.
Thank you very much. My huge pleasure.
It was an absolute pleasure, and I think we learned an awful lot today. You did say a very, very old tool, the SWOT analysis, was created in the 70s and 80s. So I was born around then, so I now feel like a very, very old tool. So
no. My apologies, Rebecca.
I was laughing. It's like, oh my God. Yes, we're all very old these days, but it's great. So thank you so much to everyone. I think it's been a huge success.
Fantastic, Rebecca. Thank you very much. Thank you, Tom.
Pleasure,
thank iheed, and thank you, all of you. I encourage us to learn together. This is the most important thing that we can do.
Absolutely. Absolutely. Thank you so much, guys. It's a pleasure. Take care, everyone. Bye.